Hello, everyone. Thank you so much for joining us today. I'm really happy to be here. And thank you also to Caitlin and Ari for inviting me to share what I've learned with you. I'd like to tell you a bit about myself. I'm from London, England, as you can probably tell by my funny accent. And I've lived in Toronto for over 30 years. And I've enjoyed a long career as a dental hygienist, almost 40 years. And currently I'm a university instructor. I also teach continuing education courses for dental professionals and write articles for dental publications. I've always had a desire to support my dental patients who are experiencing eating disorders, and this has instigated an ongoing lifelong learning about the eating disorders in order to provide that support. So this presentation will provide some tips to help maintain your oral health, the comfort and quality of life while currently experiencing or recovering from an eating disorder. This is what I'd like you to take away with you today. Some tips on self-care and on the products for good oral health to minimize gum disease, cavities and tooth wear, and also to relieve tooth sensitivity. Also, how to care for a dry mouth and tips on choosing a dental office where you feel comfortable and also communicating with your dental care professional. And some tips for managing dental fear or anxiety. And also I'll give you a little information on some of the dental treatments we provide, which will help to improve your health, your aesthetics, and the quality of life. The common dental issues faced by individuals experiencing eating disorders include a mouth that tends to be acidic and dry, which increases risk of cavities, tooth erosion, and sensitivity. Also, signs of medical conditions such as nutritional deficiencies, it can show up in the mouth. For example, mouth ulcers, a burning red tongue, bleeding gums, or cracks in the corners of the mouth. However, there are things you can do to improve these issues before and during recovery. So first of all, see your dentist and hygienist every 3 to 6 months for continuing care and support. Brush with a soft brush and a recommended toothpaste 3 times a day. Clean between the teeth every day and also clean the tongue every day. And examine your head and neck and your mouth every month. So let's talk about brushing effectively. Always brush with a soft brush, never a hard or even a medium brush. Soft brushes actually clean more effectively because they can form into all of the crevices and reach those areas more effectively. Consider an electric toothbrush as they're very effective, and also there's less chance of scrubbing too hard. You just let the brush do the work. My particular favorite is the Sonicare brush. It's a sonic brush, and they have various models from the basic to the fancy with all the bells and whistles. However, the basic model is it has the same action as the fancy one, and the price is much lower. Often you can get them on sale for under $40. Don't brush immediately after acid exposure. And when brushing, it's important to be methodical and move the brush slowly everywhere around the mouth, along the gum line. And the gum line is very important to reach because there's more plaque accumulation there. So then you don't miss anywhere. And a manual brush is also fine, as long as you're methodical and thorough and brush everywhere with small circles so that you don't miss anywhere. It should take about 2 minutes to brush the teeth, but according to the research, most of us only take 38 seconds. And this video will show you how to use the electric toothbrush.
How to brush your teeth with an electric toothbrush. An electric toothbrush is clinically proven to be 7 times more effective at plaque removal than a manual toothbrush. Here are a few top tips to get the most out of your electric toothbrush. Switch the toothbrush on and glide the brush across your teeth gently, allowing the brush to do all the work. Hold the handle with a light grip. Do not grip the handle, but hold it gently at the edges. Place the toothbrush bristles against the teeth at a slight angle towards the gum line. Often we just brush the teeth, but it's important to include the gum line because this is where the plaque will sit. Use your electric toothbrush twice a day for 2 minutes, and remember to change the brush head every 3 months.
Now, here's a crucial question. Do we really need to floss? We definitely need to clean between the teeth every day, and you might have been reminded many times to floss, but this isn't the only way to clean between the teeth. If you use floss every day and you're keeping your gums and your teeth healthy, then keep doing what you're doing. But if it's not working for you, then there are alternatives to floss, which are more user-friendly and often work even better than the string floss, such as these little interdental brushes, and you can get different sizes even to fit the tightest space. And there's also the soft picks and the water flosser. And the 2 very good brands of interdental brush are the gum and TP. So here's a demonstration, a brief demonstration on how to use these brushes.
Welcome to TP, the experts in oral hygiene. Did you know cleaning the gaps between your teeth helps remove 40% more plaque than just toothbrushing alone? First of all, choose the size that comfortably fits the space between your teeth. Insert gently, moving back and forth once or twice. Always rinse the brush after use. More than one brush size may be needed, and to reach hard-to-get-to back teeth, you can gently bend the head. If unsure, try our mixed pack or consult your dentist or hygienist for advice. Never force the brush into a space. TP daily for best results. With 94% of dental hygienists recommending TP, think TP, brush, smile.
The water flosser is also more user-friendly than the string floss. The pulsating water jet disrupts and removes dental plaque, and it also reaches under the gums better than floss. It takes about 2 to 3 seconds for the jet to remove the plaque, so it's important not to do it too quickly. Move it gradually along the gum line and pause for a couple of seconds between each tooth. And I usually recommend the cordless model because it's smaller, so it takes up less space on the counter. And here's some instructions on how to use the water flosser.
Brushing alone is not enough. If you just brush, food and debris get left behind. The Waterpik water flosser is the easy and most effective way to clean between teeth. To get started, follow these simple steps. Fill reservoir with warm water and place firmly on the base. Select a tip that's right for you. Click firmly into a handle. If this is your first use, you'll need to prime the pump. Number 1, set the pressure control to high. Number 2, point the tip into the sink. Number 3, turn on until water flows. Number 4, turn.
Oh, I'm sorry. I didn't realize looking at the chat would interrupt it. I'm going to fast
Brushing
forward
alone
it.
is not enough. If you just brush, food and debris get left behind. The Waterpik water flosser is the easy and most effective way to clean between teeth. To get started, follow these simple steps. Fill reservoir with warm water and place firmly on the base. Select a tip that's right for you. Click firmly into a handle. If this is your first use, you will need to prime the pump. Number 1, set the pressure control to high. Number 2, point the tip into the sink. Number 3, turn on until water flows. Number 4, turn unit off. Now let's get on to water flossing. Start with lowest pressure setting. Lean over the sink and place the tip in your mouth. Turn unit and water on. Partially close lips to prevent splashing and let water flow from your mouth into the sink. Aim the tip at the gum line. For best results, start with your back teeth. Move along gum line, pausing briefly between teeth. Floss front and back side of teeth for 1 minute a day. The Waterpik water flosser removes up to 99.9% of plaque from treated areas and is up to 50% more effective than string floss. You can have healthier gums and brighter teeth with the Waterpik water flosser.
This electric toothbrush incorporates a sonic brush and a water flosser in one, so you can do both at the same time. Or you can use it in water flosser mode first and then brush with paste afterwards. And this is one of my favorites. I've been using this for about 3 years. You also need to clean the tongue to remove plaque and acid residue, which can affect the teeth. So you can use a tongue scraper like this one, or you can use a combination brush tongue cleaner combination, such as the Colgate 360 brush, which incorporates this tongue cleaner on the back of the toothbrush head. Or you can just use a plastic teaspoon. However, be gentle when you're scraping the tongue, and you'll find tongue cleaners in the toothbrush aisle. Just as we do a breast self-exam each month, we should also routinely examine our head, neck, and mouth for swellings, ulcers, or red and white patches. And if you're concerned about anything, see your dentist or your physician. So this video will show you how to do your self-exam.
Being a dental hygienist is such a rewarding job. You're helping people protect their health and their smile. We also play an important role in the early detection of many medical conditions, including cancer. In between dental hygiene visits, it's not hard to do a self-exam. Step 1, tongue. Stick out your tongue and hold the end of it with a cloth to give you some grip. Move your tongue to the right and then the left and look for any red and white patches. Do the same for the top and bottom of the tongue. Use your index finger to feel for any unusual lumps on the sides, top, and bottom of the tongue. Step 2, lip and cheek. Look around the edge of your lips for any lesions, sores. Using your thumb and index finger of both hands, pull back the upper lip and look for red or white lesions, sores. Using these same fingers, feel for any lumps, bumps. Do the same with your bottom lip. Next, use your thumb and index finger to pull back the right side of your cheek, looking for any red or white patches. Using these same fingers, rub your cheek between them to feel for any lumps or bumps. Repeat on the left side. Step 3, floor of mouth. Raise your tongue to look at the roof of your mouth and look under it where your tongue rests on the bottom of your mouth for any white and red patches. Using one finger inside the floor of the mouth and another on the opposing surface from the outside, under your chin, feel for any lumps or bumps between your fingers. Step 4, roof of mouth. Look at the roof of your mouth for any unusual sores or red and white patches. Rub the roof of your mouth and feel for any new or unusual swelling. Step 5, head and neck. Using all 4 fingers to rub in a circular motion, feel your neck for unusual lumps, bumps, or tender areas. Repeat this on the back of your neck, along your hairline, and behind, under, and in front of your ears. Step 6, Say ah. Press down on your tongue with a tongue depressor or teaspoon. Say ah and look at the back of your throat looking for red, white patches or unusual bumps. Step 7. Tell someone. Call your oral health professional and have any unusual findings checked. Early detection is key.
To learn to do an oral cancer self-exam, ask your dental hygienist or visit cdho.org.
So let's talk about the acids which can affect the teeth. When experiencing an eating disorder, the mouth tends to be acidic for a number of reasons, such as frequent sugar intake, gastric reflux, vomiting, acidic drinks, and a dry mouth. And there are two kinds of acids which affect the teeth. The bacteria that cause cavities produce acid when they use the sugar that we eat to produce these acids within 30 seconds, and the mouth remains acidic for about 30 minutes. And these kind of acids, they penetrate the tooth surface to decay the teeth. The acids from acidic foods and drinks like juice or pop, or from vomiting, erode the enamel from the tooth surface. Tooth enamel remains undermined and vulnerable for about 2 hours after acid exposure because some of the minerals are dissolved. Don't brush immediately after exposure, as this removes more minerals from the enamel. Instead, the acidity should be neutralized in any one of the following ways. You can rinse with a teaspoon of baking soda in a cup of water, about 4 ounces of water. You can chew xylitol gum for 5 minutes, or you can swish a blob of toothpaste in the mouth for 1 minute. And I observed Colgate Enamel Health being tested with an acid solution, and it neutralized it very well. The factors which increase the risk of cavities include frequent sugar consumption, a dry mouth, and if you've had a cavity within the last 2 years. So let's talk about how to prevent cavities. So to prevent them, avoid sugar as much as you can. Reducing the frequency of intake is significant so that the mouth is not acidic for long periods of time. And also neutralize the acidity after sugary foods or drinks. Xylitol products are very beneficial. Xylitol is a natural sugar derived from birch bark or from corn cobs, and its history is really interesting. It was used in Finland during World War II when they couldn't import cane sugar, and then they noticed that the incidence of cavities fell. So this prompted a lot of great research on xylitol. The bacteria which cause cavities cannot digest xylitol, so they cannot produce acid and they die. So it reduces the population of those bacteria that cause cavities. And xylitol, because it's sweet, it also stimulates saliva flow, and this also reduces acidity. There are various xylitol products such as toothpaste, gum, lozenges, and you can get it granulated to put in your tea or coffee. For best results, use xylitol for 5 minutes, 3 to 5 times a day. Fluoride absorbs into the tooth enamel and makes it harder and more resistant to cavities. Fluoride toothpaste is recommended to prevent cavities, used 3 times a day. And sometimes you might be advised by your dentist or your hygienist to also use a fluoride rinse every week, but they will tell you if you need it. So I'm going to show you a lot of different toothpaste here. And this array of toothpaste that I'm going to show you can be quite confusing, but your dentist or your hygienist can give you individualized advice according to your needs, or and also the choice depends on your personal preference. I often recommend alternating between two. Use one type in the morning and in the middle of the day, and then another one at night. High fluoride toothpaste, which reduce the risk of cavities, include Colgate Prevident and Clinpro 5000. And these both contain about 4 times more fluoride than the other brands of toothpaste. Whichever paste you use, don't rinse out right after brushing. Wait for about half an hour so that your teeth will benefit from the good stuff in the toothpaste. If there are issues with vomiting or gastric reflux, stannous fluoride has shown more efficacy than other fluorides in preventing erosion by forming a barrier on the teeth that is resistant against erosion. People with acid erosion can benefit from twice daily use of a stannous fluoride toothpaste. And these are 2 examples of paste with stannous fluoride. Healthy saliva contains minerals which include calcium and phosphate that help to protect the teeth. And if you don't have enough saliva, then products with calcium and phosphate are valuable to reduce acidity, enhance uptake of fluoride, and relieve dental sensitivity. When looking for a toothpaste with calcium and phosphate, look for ingredients like Recaldent, tricalcium phosphate, nanohydroxyapatite, Novamin, and fluorocalcium phosphosilicate. These are all types of calcium and phosphate preparation. And this one, MI paste, this is also good for a dry mouth because it moisturizes the dry mouth. However, it should be avoided if you're allergic to milk products. However, if you are lactose intolerant, it's fine to use because it doesn't contain lactose. And this is not available over the counter. You need to get it from a dental office. Toothpaste with xylitol include Remin or Carry Zero by Oral Science. And this is one more option for your daily xylitol routine as one of your recommended 3 to 5 exposures. If your teeth are sensitive, always see your dentist for an examination and to find out the cause and get proper treatment and advice. If the sensitivity is not due to a cavity, then these 2 pastes for sensitive teeth are effective and fast acting. So let's talk about another common problem, a dry mouth. Saliva helps to protect the oral tissues against infection and injury. It neutralizes acids and aids digestion, and it also lubricates to help with eating and also with speech. If we don't have enough saliva, this can have a detrimental effect on our oral health. And there are various causes such as diabetes, autoimmune disease, or certain infections. So always see your dentist for an examination to find out the cause of your dry mouth. Some common causes include medications, and actually prescription medications are the most common cause of a dry mouth, particularly medications for depression, anxiety, and for high blood pressure. Dehydration is another cause because when we're dehydrated, the saliva production is reduced to conserve water. And this can happen if you haven't had enough water or if you're losing fluids through diarrhea or vomiting. Vomiting also irritates the saliva glands and affects their function. And deficiencies in vitamin C or omega-3 fatty acids also make the mouth dry. And smoking dries the mouth and also affects the saliva glands and their function. And breathing through the mouth causes saliva to evaporate. So how do you care for your dry mouth? Adequate hydration is crucial, so make sure you drink enough water, about 6 glasses a day, and you can stimulate saliva flow through various means, which I'll go into in more detail. And if necessary, saliva substitutes can be used to lubricate and improve comfort and protect the tissues. And you also need to protect the teeth and reduce risk of cavities using the routines which we mentioned earlier. There are various ways to stimulate saliva flow, such as chewing and also certain flavors like fruit flavors or sweet things. Avoid sour candy because although they stimulate saliva, they actually make things worse by causing more cavities and more erosion. Xylitol gum is beneficial, and also certain oral exercises, which I'm going to demonstrate for you a little bit later. So xylitol products are beneficial because the sweetness stimulates saliva and the cavity causing bacteria cannot digest it. So there are various xylitol products, as we've mentioned, granulated for your tea or coffee, gum, and also candy. And to get your 3 to 5 exposures a day, you can use a combination of the different xylitol products. For example, gum once or twice a day, toothpaste once a day, or granulated in tea or coffee, whichever you prefer. And if your TMJ, your jaw hurts and you cannot chew gum, then the other forms of xylitol still work well because of the sweetness. And a very important note, if you have a dog, keep xylitol away from dogs, because just as they cannot safely consume chocolate, they cannot consume xylitol. It make them quite ill. So Qigong exercises are beneficial for the digestive system by increasing saliva flow through mindful biting, tongue rotation, and swallowing exercises, which are done 20 times each. So if you'd like to join me, I'll show you how you do them, and you can join me and try it yourself and see how well the saliva flows. So you start with the mindful biting motions. So you just bite up and down. Can you feel the saliva flowing already? And this is followed by the tongue rotations, both clockwise and counterclockwise. And this is followed by mindful swallowing about 20 times also. And the swallowing saliva is beneficial for the digestive system because it stimulates the gastric juices. And you can also increase saliva flow by pushing your tongue down to the floor of the mouth. So would you like to try that with me? And you can probably feel the saliva flowing just after a few seconds. If you still experience a dry mouth after doing all of these things, then there are also saliva substitutes you can use as needed. And these come in the form of rinses, mouth sprays, or gel. And this one, Xylomelts, is a little lozenge that you can just put inside the cheek, and it just stays there for a couple of hours and melts gradually. That works very well. And these will make your mouth more comfortable and moisturize the oral tissues. So we're going to talk about choosing a dental office where you feel comfortable. And so how do you find a dental home that you like? Personal recommendation from friends is a good way, and often the online reviews are also useful. Avoid a fast-paced office. Make sure they allow adequate time for your appointments. For example, for your hygienist appointment, you should have about an hour and you shouldn't feel rushed. Communication skills are important. Do you feel heard? Do they explain things to you? Do they check your medical history at each visit? So regarding your dental checkup, after your COVID screening, for example, the questions about cough and fever in yourself or recent contacts or recent travel, we also need to look at your medical history at each visit and monitor the vital signs, the blood pressure and the pulse before we look at your teeth. It might seem as if your medical health is not relevant to your dental health, but this is crucial to proper care. Some medications affect the mouth, and also some of the things we use in the office might interact with some of your medications if you take any. And also we might notice signs of dehydration or deficiencies in iron or B vitamins or vitamin C. If you feel uncomfortable disclosing that you're experiencing an eating disorder, try not to be embarrassed. Whatever you tell us will be confidential as stipulated by our professional code of ethics. So look for these things when you're choosing your dental home. Do they examine your entire mouth, your cheeks, your lips, the roof of your mouth and your tongue? And do they examine your head and neck for swellings and lesions? Do they examine your gums as well as your teeth? For example, do they examine, measure the pockets between the tooth and the gum? Do they monitor gum recession? And make sure you ask about these assessments, ask what they found and what it means. And also, x-rays are needed from time to time, because we need to examine areas that you cannot see on examination, such as between the back teeth, underneath fillings, and also we need to examine the bone which supports your teeth. Look for the little things which they might offer, which show that they care, like making sure your lips are comfortable by applying lip balm or Vaseline, a blanket if you feel cold, a neck pillow or lumbar cushions for extra support. And lavender oil has been found to naturally reduce anxiety. So this can be dropped on a tissue close by in the room, or it can be dropped on your paper bib during your appointment. So we're going to talk about communicating with your dental professional. Please remember, you're not alone. An eating disorder is not something to be ashamed of. Try to be open within your comfort zone, because we can take better care of you if we have the necessary information. If you would feel more comfortable discussing your health in a more private setting than the dental treatment room, then this can be handled in a phone call with your dental professional before your appointment. We should respect your autonomy, so it's okay to ask questions about the rationale for what we do for you. Don't hesitate to ask for clarification if you don't fully understand something. I've seen with my patients, they might say, yeah, I get it, but they still look a bit puzzled, but often they don't want to ask because they feel they're taking up time. But this is your time, so you should ask for clarification and ask for instructions to be repeated if you're not sure. And don't be ashamed to say, you don't like flossing. Just say, I don't like flossing and I want to use something else. And then together we can collaborate and find alternatives. We partner with you to find solutions to improve your oral health that will suit you. So here's a little bit of information about managing dental anxiety or dental fear. Many people have some degree of dental anxiety, and in some it's so severe that they don't attend for dental care. Don't be embarrassed about being anxious. Again, you're not alone. Tell us you're anxious, tell us what makes you nervous and what would make you more comfortable, and then we can help you to become more comfortable. If your dental anxiety is related to past trauma, you don't have to tell us about your past traumatic experience if you don't want to. You can bring your own lavender oil if you find it helpful. And there are various relaxation techniques such as breathing exercises or visualization, which we'll go into a little bit later. And earphones with music are quite relaxing, and weighted blankets are very effective. And if your gums are sensitive, we can use a local anesthetic, which doesn't have to be injected. We can apply it under the gums to numb sensitive gums. And also we have in-office tooth desensitizing products that work very quickly that will also make your professional cleaning more comfortable. And some offices have virtual reality goggles. Here are a few more tips for coping with dental anxiety. We can share control with you by agreeing on a non-verbal signal, such as a hand signal, to indicate how you feel and that you need a break. So when you raise your hand, we can pause treatment. Ask your clinician to provide regular reassurance and explanations regarding the procedures being performed, especially to let you know when they're almost finished. And ask for extra time for your appointments. Relaxation methods such as self-hypnosis can be useful both before and during your dental visit. Guided imagery is a type of self-hypnosis which brings you to a relaxing place such as a garden and evokes the sights and sounds and sensations that you may experience in such a place, creating this safe environment in your mind. And many people, as we said, find earphones with music or just watching TV, if your dentist has one in the treatment room, is quite relaxing. And there are also relaxation apps on smartphones, smartwatches, and other wearable technologies like the Fitbit. Breathing exercises calm by means of distraction. They increase levels of oxygen and melatonin and decrease blood pressure and decrease that stress hormone, cortisol. And there are various breathing techniques designed to reduce anxiety. The 4-4-8 technique can be used, where you breathe in through the nose to a count of 4, hold your breath for a count of 4, and breathe out through the nose to a count of 8. So you can try this at home if you want to. And you can also search for breathing apps on the App Store or Google Play. And if you have an Apple Watch, the Breathe Well, not Breathe Well, for Apple, it's the Breathe app, and that's built in. And for Androids, it's Breathe Well. This is really interesting. A weighted blanket relieves anxiety by deep pressure stimulation. It reduces cortisol levels, slows the heart rate, and relaxes muscles. The body increases those feel-good chemicals, endorphins, dopamine, and serotonin. And the weighted blankets in this picture are for use in a dental office, as they can be disinfected after each use. And if a weighted blanket is not available, the X-ray apron also works. And I've used this for a couple of my patients. This lady really loves it. And she also has a weighted blanket at home, so she sleeps really well with it. And by the way, this picture is pre-COVID, which is why I haven't yet put on a mask for her treatment. Now it's quite different. Some offices have therapy pets. Pet therapy animals are trained to provide comfort to people in a variety of settings. Research has shown that therapy dogs and cats have a benefit on the mental and the physical health. They help to calm dental patients and reduce anxiety, and interacting with an animal reduces blood pressure, lowers your cortisol levels, and provides a welcome distraction for you. Some offices have virtual reality goggles. In a virtual reality experience, when you wear the goggles, instead of seeing the dental office, you'll see a peaceful, scenic environment. It makes your brain believe you're actually there by stimulating your visual senses, and also evokes positive emotions. The senses are overwhelmed by the pleasurable sights and sounds, which actually override the pain receptors in the brain as effectively as the laughing gas, the nitrous oxide, sorry. And many virtual reality experiences include relaxation techniques such as guided meditations. So let's look at a little bit of information about some of the dental office treatments which are beneficial, particularly beneficial. Regular dental visits for examination, for maintenance and support provides many benefits for your health and your quality of life, including treatments to keep the gums, the teeth and the bone healthy, to restore teeth if there are cavities, and to repair eroded or damaged teeth. And also, oral health affects your general health, so you need a healthy mouth to have a healthy body. You'll probably see more of your dental hygienist than any other person in the office. Just think of us as your supportive healthcare coach and cheerleader. We examine you and monitor your oral health. We monitor the teeth, gums, and all of the oral tissues, and monitor your vital signs, the blood pressure and the pulse, and take x-rays if needed. We also remove plaque and hard deposits from the teeth, including under the gum line, to keep your gums and your bone healthy. We might also use therapies such as lasers sometimes to improve the health of the gums if needed. And we apply agents to desensitize the teeth and prevent cavities. We can also, again, we can apply the non-injectable local anesthetic to numb sensitive gums before you're cleaning. Sometimes tooth desensitizing products for home use are not enough on their own, so a concentrated fluoride varnish can be applied in the office. So we'll look at treatments, a treatment which helps to improve aesthetics and oral health and quality of life. And tooth-colored fillings could be an option for individuals like this person who is in recovery from bulimia. And you can see her teeth were quite eroded, and they were rebuilt with this white filling material, and it shows how well it works and how natural it looks also. She was very happy. And this is the same person 10 years later, after the work was completed. So here are a few handy resources for you. More information on prevention, and the College of Dental Hygienists of Ontario is our regulatory body. They have lots of information on their website, and some information on fluoride treatment from the Canadian Dental Hygienists Association, and dentalfearcentral.org is a marvelous website. It has lots of resources for people who have dental anxiety and also for the dental professionals who take care of them. And here's some more calming apps for dental anxiety specifically: the Breathe Well app on the Android, and some more detail on the mouth Qigong tips, exercises. So here are a few words to leave you with. Please remember, you're not alone. Your dental professionals are here to help you, and you deserve to be heard. So don't hesitate to tell us about your questions or your concerns. And last but not least, make time for yourself and for your oral care. Thank you so much for coming and listening to me today. I hope the information I've provided will be useful. And now, please feel free to ask questions.
Thanks so much, Linda, for such an informative presentation and for all of the cool tips that you've given us. I don't know about anyone else, but I know even the slides and the way in which we got to see brushing happen, or even that breathing one, was so satisfying to me. So thanks, folks, for paying attention to that, and thanks, Linda, for having such a multimedia session.
It's my pleasure. It's a great pleasure. Do I need to hit escape to stop does that matter?
No, I think you're okay as you are.
Okay, lovely.
Caitlin spotlighted our videos, and I have 4 questions right now that people have submitted throughout that we're going to try to answer.
Oh, super.
The chat is now open for anyone to message, so feel free in the chat to ask some initial questions. But we're going to handle the 4 that were messaged to us first, and then we'll see where we get to in terms of time. As always, if some of you have to leave or run to something else, this is going to be included in the recording. So please feel free to log out and check back that recording afterwards. Caitlin put in details on the ways in which the recording is going to be sent, and a copy of Linda's slides will be sent to everyone, scheduled for 1 p.m. Eastern time when this webinar is supposed to complete. So I'm going to get started with some of the questions that are here. The first question, and Linda, as always, if you feel like you want to get back to an attendee and you don't have an answer to a question right away, Caitlin and I can always facilitate an email post the webinar. So don't feel free like you have to answer every question on the spot.
Okay.
Question number 1, if you cannot afford to change your electric toothbrush head every 3 months, how bad is that? If there's someone who has an issue with that.
That's a great question, because it's not bad at all. And I actually keep my my toothbrush heads for a lot longer, because they don't actually wear out so fast. So replace it when you notice that the bristles are sort of bending a bit curling a bit. Then that's time to replace it.
Okay, thanks, Linda. And let us know, it's the person who asked that question, feel free to send us direct messages and we can always follow up. Question number 2, when looking for a water flosser, could you give a few brands or price ranges so that the attendees have an idea of the range for purchasing?
So there are a number of different brands, but I know the water flosser, the Water Pick brand is actually backed by a lot of research as to its efficacy. So we know it's effective, and you can get the cordless one. I think they're about $60 now.
Thanks, Linda. Question number 3. Do you have any recommendations for non-Colgate? And this person is specifically looking for things that any toothpaste that have been tested to be cruelty-free, that are free of artificial colors and sweeteners, and like not going to harm animals that are there, because there has been some evidence around that. Any kind of ideas on that end for the toothpaste suggestion?
Tom's toothpaste is very good. So thank you for asking that question. That's a great question. So look for Tom's toothpaste, and I think they actually make one with fluoride also, if you don't have any objections to using fluoride.
Cool. Thank you. And then the last one that I have pre-recorded here. If someone is, say, having a hot chocolate, could they add a bit of xylitol to that to promote saliva, or would the sugar and the hot chocolate being consumed simultaneously render it pointless? The reason why they ask is that this person isn't a huge fan of the taste of xylitol, but also really think that it could be beneficial.
You would be better off to follow the hot chocolate with something with xylitol instead. In combination with sucrose, I'm not sure how well it will work.
Thank you. I'm now looking over at the chat to see what I've got. There's a lot of thank yous in there, Linda, as you are.
Oh, that's so nice.
If you want to click that and open it too. Someone is asking, any recommendations on tips on working up to brushing 3 times per day as suggested?
That's a good question. If you're working, if you're in the office, I'd suggest you walk with a toothbrush, keep one in the office so you can brush after lunch. And you can also set up a reminder app on your smartphone that will just buzz you and remind you to brush.
Okay. Another question that's in here. When you were talking about in-office treatments, you mentioned a white building material. What was the name? What was the treatment used for the example provided on the slide?
This is a filling material actually, and it's also used for filling cavities. And in this case, it was bonded to the teeth to rebuild the teeth. And there are various brands. It's called composite. Should I write that in the chat?
Sure. Yeah, feel free to take a moment and do that.
So that's the.
I don't know, Caitlin, too, while you're around, if you can find that Tom's toothpaste, we can also verify that and post a link into it in the chat.
Oh, yeah, that would be great. That's available from health food stores like Noah's, or yeah, they're various places. Yeah, the tooth colored material is called the composite, and it's basically a kind of a special type of plastic material which they bond to the teeth, and it also has some sort of fillers like quartz that add to the natural appearance, so it looks like enamel, and so it can be polished.
Cool. And Caitlin's putting a link in that in the chat too.
Oh, nice.
2 more questions that I have in here. This person hasn't been able to afford to go to the dentist in a few years, and I'll just name 2 just to chime in. Like, there was totally a time in my life when that happened too, so I'm really interested in this question. What would you suggest as some oral health tips to do at home in the meantime? Any kind of, I know that there's probably many, but anything that stands out to you as immediate tips for folks when are having affordability issues accessing a dentist?
I think basically the daily care is very significant to make sure that you clean between the teeth every day and brush your teeth really thoroughly, and use a fluoride product to help prevent cavities, and minimize the intake of sugar, the frequency of the intake of sugar. And also, I would say try to visit the dentist, at least to visit once a year to get an examination.
And I appreciate the way in which at least some of the slides for those who are having that issue, the ways in which I think you can use like harm reduction principles with some of the things that are in the slides. So There are lots of alternatives to which if there are certain sensitivities, to try some things that don't involve products at all, like the Qigong exercise for saliva, the ways in which some of the relaxation techniques that are in there, or ways to maybe use a different kind of toothpaste that is cheaper than potentially going to actually have that visit, like ways to kind of work your way up to that, because we recognize that there are issues for folks doing that. I have one more question that I'm going to ask, and then I know that we're at time. This person is just wondering, they said, thanks so much for all the tips. Just curious, are there any contraindications for using fluoride on ways that where that is sensitive and aren't often recommended for people that you know of in a broad base way?
The fluoride sensitivity is extremely rare, but if you really prefer not to use it, then I mean, research has shown it's really the best thing for preventing cavities. But if you really don't want to use it, then I suggest discuss it with your dentist or your hygienist, alternatives like the calcium and phosphate, and using more xylitol.
Okay, thanks, Linda. I know that we have a few more that are in the chat, and I just really want to appreciate the conversations in which folks have been able to participate in today. I'm going to post a link in the chat to our feedback form. It's something that's anonymous for you to fill out, and if there are topics that you wish that you'd like us to continue to facilitate conversations on, or ways that we can get more specific with some of the things that Linda's presented today, please feel free to include that in the survey. It's extremely helpful for Caitlin and I and Natalie in our planning as we talk about webinars. Caitlin's also put just now into the chat, and we're going to include it in follow-up emails. Just a reminder that Linda's slides are being sent out. So I saw someone highlight around a handout. We have a 3 slides per page, I think, handout version of her slides that you're free to share. You'll also have this recording that'll be posted on YouTube, and all of you will get a recording email saying that it's being shared. There's 2 links that Caitlin's put in that I want to spotlight. Sheena's Place had a community recommended list of eating disorder sensitive dental services that are in there. And of note, I want to spotlight Kate from In Harmony Dental Care in British Columbia. She's in attendance today. She provides virtual counseling, and one of her specializations is supporting people with dental anxiety specifically. So that link is also there in case there are folks from that area or folks who can't access Kate. And lastly, there are 2 more resources that I'll spotlight. There was a conversation with Cynthia Bulick and Brittany Davis on eating disorders and dental health. That was a Facebook live chat that we found really helpful when we were planning for this webinar, so all of you might as well. And finally, Bodywise in Ireland, so they're a really similar organization, Genetic and Sheena's Place. They created an eating disorder resource for dentists that's in English, that's there, that you're free to share with your oral health professional or people in your care. So otherwise, I think I just want to ask Linda to see if she has any final comments that she wants to say, but feel free in the chat for attendees if you want to add any last minute comments. But Linda, anything else on your mind?
Regarding where to get the recommended products, if you go to a pharmacy which is close to a dental office, they usually have, they carry the items which are recommended by the professionals, and also Walmart and Amazon are very good for oral care products, and Dollarama.
Cool. Thanks, Linda, and thanks everyone. Special shout out to Caitlin and Natalie for all of their help behind the scenes, and thank you to all of you for attending. We're gonna end the recording now and we'll start to tune out, but thanks for attending today.